Thank you so much for inviting me to speak to you today. My name is Ted McCann, and I worked for over a decade as a senior advisor to Speaker Paul Ryan. During that time, I worked on a number of pieces of legislation that were directly impacted by the use of evidence and data, including the passage of the Evidence Act, criminal justice reform, foster care reform, and the reauthorization of the Maternal, Infant, and Early Childhood Visitation Program. That informs my perspective and the perspective of this talk, which is that of a consumer of evidence and data at the federal policy level. That said, I'm always a bit intimidated by speaking to groups like this. The attendees here are all extremely smart individuals who are committed to finding interesting, innovative ways to help people. I spent most of my career working for the US Congress, which is to say, I did roughly the opposite. Joking aside, some of the work I did impacts the work that you do. When I worked for former Speaker Ryan, we were extremely interested in how we could use evidence and data to inform and transform public policy. At the outset, we should identify what evidence and data do in the public policy process. First, it doesn't make decisions, it informs decisions. One regret I do have about the Evidence Act is that we titled it The Foundations for Evidence-Based Policy, when evidence-informed policy would have been better. Second, fundamentally, what evidence and data do in the policymaking process is shift the conversation from values to trade-offs. When values are misaligned, the relative cost of the trade-off is extremely important, and evidence and data can ensure that policymakers are properly evaluating those trade-offs. So when we think about the use of data and evidence in public policy, we want to understand how it flows up and down in the broader system. Initially, there's the policy creation. Either federal or state policymakers will use data and evidence to create a program or policy in the first place. That data can be good, it can be bad, or it can be ignored. But when it is good and not ignored, it provides for the thoughtful creation of public policy. Raj Chetty's work in this regard has been instrumental. His Equality of Opportunity project was influential at very, very broad levels, but also at smaller programmatic levels. For example, he shifted our understanding of a small housing program called Moving to Opportunity, which is a pilot program in the 90s. It was originally seen as a failure, and now we see it as a success. Second, it helps those who administer policies iterate programs much faster. While the Congress can't move quickly, a well-constructed statute allows for agencies and other administrators to change how they fund programs based on the evidence they received. And finally, and fundamentally, this is a key area where too little attention is paid. The actual payoff is that by ensuring that individuals who need services are getting services that are effective, you are both improving those individuals' lives in a meaningful way and creating a feedback loop where support for these programs can grow. This isn't a top-down process. It works both ways. Sometimes federal or state policymakers drive change. Sometimes local programs or local policymakers drive change. So that's how we see data being transformational in the public policy sense. It flows from the policymaker level with thoughtful changes to statutes. It continues through the administration of those policymakers' wishes with a thoughtful implementation. And finally, the payoff is when you actually provide services to people that are effective in improving their lives. When this works, it works really, really well. You can see this coming together in the creation of the Maternal, Infant, and Early Childhood Visitation Program. This is a program that was created under President Bush as a pilot project. It was codified under President Obama in the Affordable Care Act, and it was reauthorized under President Trump in a Republican House and Senate. It's a very rare lineage for legislation. So why does this program enjoy such strong support? It enjoys that support because the movement between the policy of the program, the administration of the program, and the reception of the program is seamless. Congress sees a properly implemented program fundamentally achieving the results it wants, and it supports it. And most importantly, it is achieving the outcomes for the individuals who participate in that program. When we passed the First Step Act, which was the most meaningful criminal justice reform bill since the 1994 crime bill, we did it because local and state governments started experimenting with new ways to both reduce incarceration and recidivism, improving both public safety while reducing human suffering. In these situations, the transmission of data was transformational to federal policy, to state policy, and to individuals. These are the success stories. And there are others, but all too often, the transmission of evidence either of success or failure, is then transmitted up or down the policy architecture, and we regularly see a breakdown in the transmission of what policymakers want and what is delivered on the ground. I titled this talk Fixing the Slip from the Cup to the Lip, because this is an issue that is endemic to public policy, and it's something that policymakers regularly think about but rarely have been able to solve. There are a number of reasons for this. Some are structural. Congress or state legislatures just don't set out clear metrics or goals, so there isn't an actual goal to measure against. Other times, people have conflicting goals, and they want different things. This issue is a structural issue, and one of the largest problems that we are going to always face in the use of data and evidence to transform public policy. When decision makers don't know what they want, then they can't actually measure against things to figure out if it's working or not working. But those issues are generally upstream, and they're highly dependent on individual decision makers and very difficult to change. There's also the translation of evidence downstream and how a program participant will receive services that are created. Will they receive services that have an evidence base supporting their effectiveness based on their individual characteristics, or will they be referred to services that aren't useful? We tried to address this when I worked in the office of the Speaker, and the Congress has tried to address this throughout the years in multiple ways. And one of the things that we've done regularly was create various What Works clearinghouses. These are useful tools. I created one for the Temporary Assistance for Needy Families program, or TANF. We created one when we reformed the foster care system. Previously, the Department of Education has had them created, and multiple others have created these types of tools to inform program decisions for individuals so that they could use programs that were effective for them. Unfortunately, that hasn't happened. While it hasn't happened for a number of reasons, one key reason is that we never consulted individuals who actually make the referrals on what a useful tool would look like. Right now, if you're a social worker or other individual who regularly makes program referrals and want to use evidence, you're going to be presented with a confusing array of clearinghouses that are fundamentally inert PDFs without any context on the level of evidence a program has backing it, or an understanding of how it can help a specific client with specific needs and specific characteristics. So we face a situation where federal and state policymakers have created these clearinghouses specifically to help determine what programs can be most helpful for specific individuals. But at the ground level, it has been almost useful for this purpose. One of the things the American Idea Foundation is currently working on in conjunction with the Sorensen Impact Center and Stand Together is a tool that will translate the evidence developed around child welfare programs to inform people who refer individuals to those programs. By developing a tool that takes frontline workers' concerns and issues as the starting point and building a clearinghouse around their needs, we hope that we can take the last mile and truly transform the lives of individuals who are in the child welfare system or adjacent to the child welfare system. We hope to do this for other programs as well: job training, early childhood programs, any place where there's a wide variety of programs that are not easily assessed and where individuals have wide latitude at referring individuals to specific services could use a tool like this for on-the-ground social workers or other types of individuals who make referrals. And if we could do this for all in programs, where an individual who needs help receives a response for a social worker, or other individual who makes program referrals that is based on evidence of their effectiveness for their unique characteristics and for their unique needs, we can fundamentally improve how individuals receive services. And broader than that, if individuals who make referrals regularly use evidence of effectiveness, we can begin to incentivize the use of data and evidence across the government sector so that all programs begin to be evaluated with a focus on outcomes. So broadly, as we think about how we want to use data to be transformational, we want to think about linking those three concepts: the initial policy creation, the administration of the policy, and the individual on the ground participating in the program. And the only way that we can be successful in what our ultimate goal is, helping those in need, is if we're able to use evidence to transmit the success or failure of a specific program to the decision makers who need that information. Thank you again for allowing me to participate in this wonderful event.